Let's listen to an expert doctor about hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart.
I'm Dr. Jagadeesh, Senior Consultant Physician, KIMS Hospital, Secunderabad.
Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
Hypertension, according to American Heart Association guidelines, we have defined it based upon its systolic and diastolic blood pressures. So the blood pressure when we check, whichever is on the top is called systolic and whichever is in the bottom is called diastolic. So they have concluded when blood pressure more than 130 in the above and more than 80 in the down is called as hypertension or defined as hypertension. So simply speaking, more than 130 by 80 is defined as hypertension. But a very important thing is how to check it and how many times to check it. So if a person has more than 130 by 80 in more than two different occasions, we call them or we label them as having hypertension.
Doctor, can high blood pressure be completely cured?
More than 130 by 80 is defined as hypertension. So we have to understand the treatment. The treatment varies in different age groups and based upon their different comorbidities. So most important thing is in hypertension also, are they coming under elevated hypertension or hypertension category 1 or hypertension crisis? Based upon that, we have to set our treatment plans. So if any time for the first time we diagnose someone as hypertension, initially we plan for non-pharmacological therapies. It means we treat them without medications. We see them, will it work on that? So in non-pharmacological therapies also, dietary restrictions and dietary approach to stop hypertension. It's decreasing salt intake every day as well as increasing lot of fresh fruits and vegetables in the diet and also trying to reduce weight. These are the important lifestyle modifications we recommend for the patient in terms of reducing hypertension. In spite of following all these things, if still the patient continue to have hypertension after 1 to 3 months, then we might start medications. There are several medications based upon their mechanism which works at different levels to control hypertension, but every patient, every clinical scenario is different. So step by step on multiple visits to the physician, we treat the patient. So most of the times all hypertension at different levels is always cured. Cured in the sense they need some maintenance of medications and lifestyle modifications to be continued. Only in very few percentage completely can be cured without medication.
Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
There is increased incidence of hypertension in lot of youngsters and the reasons might be varied. But one strong important reason to identify the increased incidence of hypertension in all the young crowd is because maybe too much of knowledge and too much of misunderstanding or apprehension as also poor lifestyle what they are leading. We have noticed a significant number of young people like 25 years to 40 years of youngsters coming up with very high blood pressures irrespective of their poor health. So this can be correlated or this can be emphasized more into the poor lifestyle what. It can be improper eating habits, improper sleeping habits or the amount of pressure what they have at their workplaces or their personal life. So this is one of the important reasons what we have noticed increased incidence of hypertension. And of course sudden cardiac deaths, there are different studies going on that. Again, this is partially responsible for even sudden cardiac deaths also. So understanding about hypertension and having a reliable source of information and follow up with a sensible doctor is more important to define someone to have hypertension or their treatment or their follow-up.
Public awareness initiative by Glenmark Pharmaceuticals.